We do have one item number 4, SB 1101, Wykowski Alcohol and Drug Counselors Regulation. It was held over, I believe, till next week, so it won't be heard today. Once we, and I believe we have, be able to establish a quorum, so call the members, please.
Hernandez?
Here.
Hernandez here. Nguyen? Nguyen here. Hall?
Present.
Hall here. Mitchell? Monning?
Here.
Monning here. Nielsen? Pan? Roth? Roth here. Wolk?
So we'll go ahead and get started, and just let the record reflect that Senator Hall actually showed up on time today. Just an observation.
I knew you had a bill up, Mr. Chair.
So is that the reason why? Okay, we're going to start off with item number 2, SB 955 Bell, State Hospital Commitment Commensurate Release. Senator, welcome.
Thank you, Mr. Chair and members. This is SB 955 that I'm presenting today. And to start, I wanted to thank you for working with us on 2 amendments suggested by the committee, the technical amendment, and the amendment which certifies that patients will not be released without a verified placement. And we are happy here to accept those amendments as authors' amendments. The bill, SB 955, would ensure that all state hospital patients are eligible for compassionate release. The bill is a compassionate measure that ensures that all patients are treated equally and allowed to spend their remaining months with families in a less restrictive environment than a state hospital. Current law allows for compassionate release for state prison inmates. That includes state prison inmates who are receiving treatment in a state hospital. However, other state hospital patients, such as those who are not guilty by reason of insanity, are not eligible for compassionate release. So some are eligible, some aren't. This creates a situation in which a patient can be in a coma and unable to receive treatment, but they can't be placed in a more palliative care setting closer to their loved ones. SB 955 would create a compassionate release program for all Department of State Hospital patients. The patients who participate in the program would have to meet specific criteria, like they're no longer posing a risk to society, and petitions for release would have to be approved by the court that committed the patient. This would allow terminally ill patients to live the remainder of their lives in a more humane environment. Now, additionally, the patients released from the Department of State Hospital facilities are eligible for Medi-Cal, Medicare, and Social Security, allowing the state to pursue federal matching funds once they leave the hospital. Of course, we know that when they're in the hospital, it's difficult to get those funds. It would also allow the state hospitals to admit and treat patients who are waiting placement in the hospitals and can benefit from treatment. The bill is supported by staff that interact with these patients every day, including physicians, psychiatrists, psychiatric technicians, and nurses, supported by patient rights advocates. I respectfully ask your vote. We have witnesses, Mr. Chairman. Thank you.
Thank you. Anyone like to speak in support? Please proceed.
Good afternoon. Doug Chiappetta with the Union of American Physicians and Dentists. We represent the physicians in State Hospital. Essentially, this bill is very similar to legislation previously signed into law for CDCR inmates. It allows a patient in the last 6 months of their lives who are terminally ill to be assessed by our physicians and deemed appropriate for community placement. It'll be done on an individual case-by-case basis. Current law with respect to CDCR has allowed a very small segment of the population to be released. There are a lot of checks and balances in the system, and we commend Mr. Bell for introducing this bill to bring some parity to the issue. Thank you.
Thank you. Please proceed.
Good afternoon. Mark Victoria with ASME Local 2620, representing psychologists, social workers, and many other job classifications throughout the Department of State and Hospitals. We also stand in support of the bill. we feel that it is necessary for those that are within the last 6 months of their lives to be able to go home and rest with their family. So we thank Senator Bell for his support in introducing this bill and ask for your support.
Mr. Chair and members, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees. I'm here in strong support of the bill, which is good public policy, but also here in strong support of our affiliates who have members who do this work every single day interacting with these patients. We just believe that it's the most prudent and efficient use of taxpayer dollars to allow us to maximize the care on the folks who really need it and provide other folks with a pathway to be able to have that care in their dying days in the community. So we would respectfully ask for your vote.
Mr. Chair and Senators, my name is Kobe Pizzati with the California Association of Psychiatric Technicians. We are the largest direct level of care providers to these patients, and our members see every day what state these patients are in and what level of care they need, and they find that these people need to be in a more compassionate, less restrictive environment that is closer to their families and homes so they can live out their remaining days there. And with that, we support the bill.
And Mr. Chair, members, Amanda Levy on behalf of the California Psychological Association. Our psychologists work in these facilities, and we are in support for the reasons previously stated.
Thank you. Seeing no other support, opposition? Is there opposition to the measure? Any questions, comments? Senator Nielsen?
Senator Bell, this is an area I'm extraordinarily familiar with, and the imminence of death is pretty loosely interpreted, always has been. And, you know, the imminence has never, ever been very certain, but that's not my point. These individuals have varying degrees of mental conditions. Is there a requirement if one is granted a compassionate release under this circumstance that they then have to be referred to the Board of Parole Hearings for the compassionate release hearing that has to be, used to be the case? They have to have a hearing and the board finds them worthy of that, that release? It's not an automatic decision, in other words.
The majority of the people in the state hospital now that are under jurisdiction, you can correct me if I'm wrong, they're under jurisdiction of the Board of Parole Hearings.
Yes.
Have to go through the process that's currently law.
Okay, sure.
This is for those that aren't on, you know, they're under some court order, and I think that's correct. It's more of the civil commitments, not the forensic commitments. Yeah.
Okay. Kobe, yes.
Yeah, Senator Nielsen, these people are not guilty by reason of insanity, so they haven't been adjudicated. So therefore, a Board of Parole hearings would not be appropriate for them. That's why, as Mr. Bell said, they go back to they petition the Court of Commitment, and that's
Okay.
why they would.
So that's where they would be housed. Now, is there any requirement then, if they are then granted the compassionate release to the community, they have a mental condition and that is required that they be under treatment, a requirement that they in fact have that treatment in the community?
Well, the amendments that specify a discharge planning it takes care of that. We're talking about people that live, you know, the process itself, compassionate release, I know the Department of Corrections takes a couple months. So when you say 6 months, you're actually talking about 4 months. Possible, you know, I had one person in my area that didn't make it the 2 months after they applied. They passed away a week before the hearing, the final decision, and it was a sad case. But I think this process takes a couple months. They have to go through several hoops. The department head has to approve it. It's a decision that's made with discharge planning included, you know, so they have to know where they're going, what kind of care they're going to receive, all the plans for care, and whether or not it's adequate.
And so, but it would include mandatory medication if they are on medication while they're in
That's medically necessary, I think, for the palliative care that they need.
Okay. But for also the mental condition, because some could be with a mental condition that might render them a danger to self or others too, correct?
Well, I think it's yes, I think it's medical. I can't say everybody that's got a mental condition needs medicine. It's based on medical necessity, the criteria of medical necessity.
And if there's,
Not yet.
if I may, through the chair, if there is an order of involuntary medication, that follows the patient wherever the patient goes. So I think what you're getting at, Senator, is their treatment plan continues. So if that treatment plan goes out and they're in a skilled nursing facility out in the community, it would still follow.
Okay. And just to add to that, Doug Chiapetta with UAPD on the physician side, there'd be no disruption in medication plans. The whole point here is to assimilate them back into the community, but not having any disruption in medication that they were treating for their mental health issues. This is, there would be no disruption in the plan.
The language in under C here says permanently medically incapacitated requires 24 total care, medical director responsible for the care, and the director of the hospital certify the patient is incapable of receiving mental health treatment. And that's one of the provisions. Okay. Thank you.
Any other questions, comments? Seeing no other questions or comments, is there a motion by Senator Hall? Senator Bell, I will be supporting the bill. I want to thank you for considering the amendments. My concern was that if these individuals will have a place where they can land, I didn't want them just be obviously out in the street or not having the continuation of care. But anyway, would you like to close?
Thank you, members. Request and I vote. Thank you.
Thank you. This is item number 2, SB 955, due pass as amended to public safety, moved by Senator Hall. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, no. Hall. Hall, aye. Mitchell. Monning. Aye. Monning, aye. Nielsen. Nielsen, no. Pan. Aye. Pan, aye. Roth. Roth, aye. Wolk.
Currently has 5, enough to get out, but we're going to put that bill in call. I think we have a
Thank
couple
you.
of absent members. We're going to move to item number 3, SB 1002, Mining End-of-Life Option Act, telephone number.
Take it.
To who? Good afternoon, Senator. Welcome.
Thank you. Good afternoon, Mr. Chair and members. I want to start by accepting the amendments agreed upon between our staffs that are reflected in the mock-up today. Also want to acknowledge co-authors on this bill, Senator Wolk and Assembly Member Eggman. Members, as you all know, last year, California achieved a historic milestone by successfully passing the End-of-Life Option Act. This legislation allows for terminally ill patients who meet specified qualifications to have the option to self-administer medications that will result in an earlier death as an additional end-of-life option available to them. An important aspect of the Act is that participation is completely voluntary for all parties, including the patient, physician, and healthcare providers. As a result, a void remains for accessing accurate information about the provisions included in the Act when any of the parties might have questions. Currently, organizations such as Death with Dignity and Compassion and Choices are acting to fill this need as a resource to answer the many questions Californians are asking about the new law. Though they're doing a tremendous job, it is essential that there be an independent and objective entity to answer these questions and be identified to fill this role. SB 1002 is designed to address this issue. It will require the Department of Public Health to maintain a toll-free telephone number for the purpose of responding to inquiries regarding the provisions contained in the End-of-Life Option Act and to post the number on its internet website. Furthermore, it will only require that the telephone number operate during normal business hours. Some are suggesting that this telephone number is intended to promote the act, and I want to make it very clear to the committee that this is completely inaccurate and, in fact, misleading. by requiring the state to establish an independent method for Californians to access information about the provisions contained in the law. This will remove the dependency on advocacy groups who may have more influence on an outcome but are currently the only entities offering information. SB 1002 will provide the critical impartiality and act as a central location for those who have questions about the law to seek clear and accurate information. Mr. Chair and members, with your permission, would like to present Mr. George Amy, who's traveled from Oregon, president of the Board of Directors of Death with Dignity, very involved with the implementation of the law in Oregon over the last almost 20 years, and Ms. Tony Brodus, who is a leader of the Compassion and Choices in California. Thank you.
Thank you, Chair and members of the committee. As the Senator said, my name is George Amy, and I'm presently the board president of Death with Dignity National Center, and also a former Oregon legislator, and executive director for 12 years of the organization that facilitated the implementation of Oregon's law. Actually, it's been 23 years that I've been involved in this movement, assisting in the passing of the Death with Dignity law, not only in Oregon, but in Washington, Vermont, California, and Canada. And I learned during those 23 years the importance of providing factual information to those who wish to consider the option of using such laws and to educate their medical providers on the safeguards and provisions of the law. We learned very quickly that those who are facing imminent death need to know their end-of-life options so they may spend their remaining months and days in peace of mind and comfort. Oregon has led the nation in giving its terminally ill citizens unbiased materials and facts about its Death with Dignity Act. Because Oregon was the first, we had to set up a system of some type, and that's when the Department of Health in Oregon established a web page, which I urge you to visit, which has not only all the forms, all the information, and there's a list of Q&As and telephone numbers for people to call. Because we're a smaller state, some people who call the Department of Health will get Dr. Katrina Hedberg immediately by the phone, and she's the state epidemiologist who heads the organization to gather all of the data on our Death with Dignity Act. So now that Californians are going to be able to avail themselves of an Oregon-type End-of-Life Option Act, I'm urging you to pass a similar type of legislation that will provide unbiased, factual information instead of having to call our organization or any other organization. And I can tell you during the past few months, about 10 to 15% of all of our phone calls come from California asking about the law. Our webpage is the same thing. We have a lot of information and requests. I get calls at my home from doctors here in the state of California wanting to know about the law. They're confused, they don't understand the details, and I think an unbiased, factual person could give that information. So I urge you to pass this amendment. Thank you.
Anyone else in support, please proceed.
Hello. Hello, good afternoon. My name is Tony Brodus, and I am the California Campaign Director for Compassion and Choices. We are the largest national organization working to improve care and expand choice at the end of life. We have 15 staff members in California and an office in Los Angeles. I am here today in support of SB 1002, which would set up a state-run phone line dedicated to providing information about California's new End-of-Life Option Act. I can tell you that the demand for information is already great, despite the fact that the law will not go into effect until June 9th. In December, CNC launched a bilingual access campaign in California to educate healthcare consumers and healthcare providers about the End-of-Life Option Act. Since then, our California Access team of staff and trained volunteers has made hundreds, literally hundreds of presentations on the End-of-Life Option Act, and requests for information continue to pour in. We have explained the law on medical aid in dying at community centers, retirement communities, hospice staff trainings, medical schools, libraries, town hall meetings, service agencies, house parties, professional meetings, and conferences across the state. People want this information. They want to know how the law works, when it will go into effect, what are the eligibility requirements. They want to know how long the process takes, or what do you do if your doctor does not want to participate in the law. Many folks want to know what are the safeguards that are in the law that will protect the vulnerable. So we get questions all over the map. Just last week, I was at a town hall meeting that I did with Senator Monning in Morgan Hill. A woman came up to me after the discussion and told me her story. She had 3 weeks earlier just been diagnosed with a cancer that runs in her family. She had seen her father and her uncle die very painful and prolonged deaths from this cancer, and she was already trying to figure out how she could avoid that fate and live her life with as much quality, with just as much focus on quality of life as possible. But she didn't even know which of her doctors to talk to or when she would be eligible to make the request. So those basic questions come up repeatedly. I'm getting hit on Facebook with friends of friends who are wanting to know, who do they talk to? If many doctors, even doctors who are supportive, are not yet knowledgeable enough about the law to talk to their patients. I also just want to let you know that, like Death with Dignity, we have seen a pretty significant increase. We run a national consultation line for people in every state to talk about their end-of-life options. We've seen about a 25% increase in calls from California since the law passed. And over the past 30 days, we've gotten about 350 calls. We expect after June 9th to see an increase of up to as many as 1,000 calls a month. One of the things we have learned from Oregon is that even though very few people ultimately take the medication, thousands of people ask about it. They want information, they want to consider it. So we know from studies in Oregon that even though less than 1% of people actually use the medication, 17% of dying Oregonians considered the option and looked at the information about it. So we could be seeing in California, if you use the Oregon numbers, information requests of tens of thousands in the first year alone. There's a lot of demand to just understand what the law does and if it's right for people. This is why we think we need the telephone line in California. People need a place to call and get their questions about the law answered. It has nothing to do whether they support the choice or oppose the option. People still need information, and I would urge you to vote yes on this bill. Thank you.
Thank you. Anyone else in support? Opposition?
I think you guys are okay.
I think there's enough room. You can stay there as well, and we'll have the opposition over here. There's plenty of seats. There's a seat up here if you want to come up as well. There's plenty of room.
Good afternoon. I'm Mark Ramoser, the community advocate with Silicon Valley Independent Living Center, a nonprofit that serves people with disabilities in Santa Clara County. SVILC, as well as the Disability Rights Education and Defense Fund, DREDF, represented by Marilyn here, a National Law and Policy Center on Disability Civil Rights, oppose SB 1002, the End-of-Life Option Act dedicated telephone number. We see the bill as an expansion of the assisted suicide law before it even goes into effect, as a way to promote usage of the assisted suicide law. Last year, the authors and proponents said this was a private matter, between doctors and patient only, and now the state would be playing a role in promoting the law. There is no way to limit callers to people who are terminally ill, which is the distinction made in the End of Life Options Act. Anyone could call, people who are depressed, people eager to end the life of a family member. Will the state go beyond providing information about the End of Life Options Act? Will it make referrals? If it refers callers to Compassion and Choices, what about, say, Final Exit Network, which actively assists people to kill themselves without involving a doctor? If the state refers people anywhere, it should be to crisis hotlines, because, again, anyone could be calling, not only people eligible under the Act. The amendments that just came down today do seem like a good start, although I would very much like to see the protocol for assisting callers in crisis fleshed out a little bit. So now I'm wondering how state staff, in any department, whichever one you settle on under the amendments, respond if a caller says, "My doctor won't prescribe lethal drugs to me because she says I don't qualify. Can you tell me who will? I am depressed and want to kill myself. What should I do?" Will the state refer that person to a crisis hotline? It should. I believe my father is being coerced to utilize the End of Life Options Act. What will the state do? Note that there is no investigative mechanism available to refer them to. Will it refer callers to law enforcement? How can I get medicine for pain? How will the state respond? Who in the state, from whatever department ends up tasked with this, has the answers to this? All the referrals suggested above should be made, not only to assisted suicide groups such as Compassion and Choices, but other key resources like crisis hotlines, law enforcement, emergency medical services. And wouldn't it be a greater service to appropriate funding to ensure that these problems are investigated? The state has no proposed process for addressing or even collecting reports of coercion or abuse, still no way to investigate them, and yet is appropriating funds to hand out information on an assisted suicide law that has very few protections. Shouldn't the bill require that information about callers and their questions be compiled? That should be publicly available information. Is this a hotline? That word is not in the bill or analysis, but it's been used in connection with the bill frequently. The Oxford Dictionary website defines hotline as a direct telephone line set up for a specific purpose, especially for use in emergencies. Is this an emergency hotline for people who want to bring about their deaths? Suicide hotlines work to save callers' lives in personal emergencies. We oppose the state starting a hotline about how to kill yourself without the resources to help people in distress to stay alive. Thank you.
Thanks, Mark. I'm Marilyn Golden. I'm from the Disability Rights Education and Defense Fund. Creating this phone line is impossible to reconcile with the state's longstanding duties to prevent suicide and enforce laws prohibiting homicide, since callers could be anyone. Referrals should be made not only to assisted suicide groups such as Compassion and Choices. Other key resources could include crisis hotlines, law enforcement, emergency medical services, and resources for palliative care. Phone answerers should do a basic phone screening and refer people to crisis hotlines if appropriate so they can get mental health support. Patients requesting death may need resources and services that can remove any wish to die. Only just a few minutes before the hearing, did we see the amendment, which could be a good start if it was made clearer about which kind of crisis resources the phone line would refer to. But there's no guarantee that the phone answerers will be adequately trained to properly refer callers, and no way to guarantee they'll call law enforcement when there's a suspicion somebody is being coerced to end his or her life. Instead, we fear that phone answerers will see their role as promoting life-ending options and could refer callers to groups who might be less than fully committed to sustaining lives when that is appropriate. Another hypothetical that raises state liability is, let's say someone not eligible for the End of Life Options Act calls this line, is referred to somewhere other than a crisis hotline, and then kills him or herself. Is the state legally liable? utilizing state resources for a perceived suicide assistance hotline instead of a much-needed increase for suicide prevention is poor public policy and contrary to the state's goal of preventing unnecessary loss of life. We're concerned that this bill will send mixed messages to people with mental disabilities or who are depressed. Further, before resources are expended on promoting the assisted suicide law, the state should address the underlying reasons for patients' requests for death, such as actually implementing the 18-month-old law allowing a palliative care benefit, which is still not effective, or adopting reimbursement rules for advanced health planning similar to Medicare. One last point before I close. One new problem in the California law that this bill revealed is that unlike either Oregon or Washington state, the California law has no requirement that the state annual reports to the public include the reasons patients wanted lethal drugs. This was not discussed during the debate. Just wanted to make sure people know that. That's new information. We oppose the state of California starting a hotline about that could be perceived as a place to call about how to kill yourself or to get an ill relative to use the law without making sure the resources are there to help people in distress to get the comfort and support if that's all they need to stay alive. Thank you so much.
Good afternoon, Mr. Chair and members. Sandra Palacios with the California Catholic Conference. We also stand in strong opposition to this bill, and we'd much prefer legislation and funding that is actually aimed at improving quality access to palliative care and hospice care. Thank you.
Greg DeGiero with the Arc of California, the state's largest membership organization of people with and representing people with developmental disabilities. We join the other disability groups in opposing the bill. We are happy to see, very happy to see the requirement for a protocol, and we think that might open the door for amending the bill further to get a much more detailed protocol that might be able to take care of most of the problems that have been raised in our letter to you and today, and we'd like to work with you on that.
Okay, seeing no other opposition, questions from any of the members? Seeing no questions, I believe Senator Roth moved the bill, and Senator Monning, oh, I'm sorry, Senator Nielsen, didn't see you.
Well, I would certainly, I don't know that we could accomplish it today, but I am not prepared to support it today. I am concerned about the protocols and the training required of the individuals who are doing receiving the calls. And it ought be, in some manner, there be some protections that the individual receiving the calls not be an advocate in any manner or way, and some particular requirements and some monitoring so that that is assured that they are not doing advocacy. And indeed, that it be examined and the protocols be very strict such that there not be state liabilities created. I appreciate in Oregon, the former legislator, that the director or someone very knowledgeable can personally take those calls, but I'm certainly that California could not have anybody at such a level of knowledge, but we should do the best we could. So I know Senator Monning is always sincere to try to do something. You've made some amendments that have taken a step in the direction of protocols, but I would say that some more yet needs to be done. That's all.
I'll be, Senator Pan.
No. Thank you very much. And, I know that certainly in the debate for the original bill, a lot of concerns were raised. As someone who actually did not vote for the bill, I am actually going to be supporting this bill because it is the legislature and the governor have spoken. It's law, and we need people to have accurate information. I'm sure Senator Monning will address some of the statements made. My understanding is this is really about being sure people have accurate information about what the law actually is. The law, and I appreciate that both Senators Monning and Wolk, when they developed the law, worked to be sure we put in very important protections in the bill that is now the law. And we need to be sure that both patients and physicians know what those protections are. And I think that's a very important part of this number, because while we may have spent a lot of time talking about it here, out in the field, people don't know all the details, and it is important for people. This is not a how-to to end your life. This is about how do I get accurate information about, including the protections that were built into this very law to try to help people. You know, we debated the previous law. Let's be sure people have accurate information. And that's why, even though I was skeptical about the law, I will be supporting this bill because I think it's very important that people have accurate information. Whether we agree or disagree with the law as it is, it's important that people have accurate information about what the law as it is. Thank you.
Senator Monning, I'll be supporting the bill. As would reiterate what Senator Pan said, yes, this is the law in the state of California. I believe the most important thing is accurate information for individuals who want to seek it. The concerns I had, and I appreciate the amendments you took, is the individuals who are on the call, receiving the call, adequately educated, and what do they do if there's somebody that needs precisely what they want, which is crisis, counseling, mental health, assistance, et cetera. That's why I'd asked for the amendments. But I think the emphasis of the bill is obviously to get accurate information, but we need to address the unintended consequences as well. So with that, I'd just like to ask you to close.
Okay, thank you, Mr. Chair and members and all who contributed to today's discussion. And just to summarize quickly, a couple of the points raised that I think it's important on the record to be very clear. This is not a hotline. A hotline connotes a crisis line for counseling or services. This is an information telephone line that would operate during business hours. It is our expectation that the people trained who are currently operating call lines for the state would have very specific training on the protections of the bill, and we've accepted and appreciate the expansion that there would be training and protocols if a caller is determined to be in crisis, that an appropriate response would be provided and potential referral or a call from that crisis line operator to law enforcement, whoever. Let me be very clear. This information line is not a line to persuade people to end their lives. This is not an advocacy line. This is not a hotline. This is not a counseling line. It will provide a patient, a physician, and yes, even a family member who might be curious to know what might be available for a loved one. They will be informed of the absolute protections that Dr. Pan referred to. I think Mr. Amy would agree, and Ms. Broadus. This bill has greater protections, the law does, of any law in effect in the United States. We have mandatory translator, interpreter declarations for non-English speaking patients. We have felony provisions for any healthcare provider, physician, insurance company that in any manner seeks to coerce a patient into availing themselves to the rights established, private meetings with physicians, to independent physicians, et cetera. So this is designed to make sure members of the public, physicians and patients, have access to accurate information about what the law provides, the protections it provides, and the penalties it provides that could clarify for a family member that they could be subject to felony prosecution if they were seeking to illegally persuade a loved one against their will. So we look forward to continuing to work on this. I want to thank you, Mr. Chair, and your staff for the constructive inputs. And with that, I would request and respectfully ask for an aye vote.
Thank you. We have item number 3, SB 1002, due pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, no. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, no. Pan. Pan, aye. Roth. Roth, aye. Wolk. Hall. Hall, aye.
Currently has 5, enough to get out. We still have some members absent. We'll put that bill on call.
Thank you, Mr. Chair. Thank you, members.
We're going to move to item number 1, SB 923, Hernandez, and I'll turn it over to the Vice Chair.
Thank you, Mr. Chairman. The subject of SB 923 is healthcare coverage cost sharing changes. What's that?